Welcome to Lira Clinical's Continuing Education Series. Melasma is one of the most frustrating and challenging skin conditions we face, and I'm excited to present to you our two-part series, Unmasking Melasma. In part one of this series, we focused on the science behind this challenging type of hyperpigmentation of the skin, including the hyperpigmentation process and triggers, pigment-regulating hormones and how they stimulate and communicate with melanocytes, and internal factors specifically related to melasma, such as estrogen and progesterone imbalance and thyroid disease. We also saw how Lira Clinical's advanced ingredient technology can address that process of hyperpigmentation by disrupting melanogenesis at multiple levels, which in turn provides effective correction of melasma's visible dark patches on the skin. Today, in part two of Unmasking Melasma, I'll share my proven method of addressing and treating melasma with my favorite Lira Clinical products for home treatment and in-clinic professional smart peels. I really think you'll be surprised by just how easy it is to incorporate Lira Clinical skincare system and truly target the symptoms of melasma for overall success and true results. When faced with melasma, or honestly any challenging skin condition, I highly recommend approaching it like you're solving a three-piece puzzle. And in over 20 years of practicing, this method has never let me down. Remember, it takes a team to complete this puzzle. You and your client must work together as a team to be successful. Our first puzzle piece and responsibility as skincare professionals is to utilize Lira Clinical skincare system to recommend highly effective products for home care and treatment, as well as providing corrective in-clinic smart peels. Our client is then responsible to follow our professional recommendations and be committed to the system. Our second puzzle piece is to uncover any external factors that may be contributing to the hyperpigmentation of melasma. Anything that may be triggering that inflammatory response within the skin, especially exposure to ultraviolet rays. Now, most external factors can easily be addressed by elimination, modification, or by simply adding additional protection from them. Our final puzzle piece plays a huge role in persistent melasma and cannot be overlooked. I promise that if you skip this piece, because that puzzle remains unsolved, you and your client will be left disappointed with little to no improvements. We must uncover and address any internal factors that are contributing to the symptoms of melasma. What internally can be triggering inflammation or overstimulating melanocytes, all leading to hyperpigmentation? The most common internal factors are stress, hormone imbalance, thyroid, and gut health. And unless we're also medical professionals, these internal issues are out of our scope of practice. So how can estheticians address these internal issues if a client isn't already under medical care? If you're not already practicing in a wellness center, you can easily design your own wellness dream team. Just find professionals in your area that are experts in their field that you can refer your clients to. And I would definitely start by adding those medical professionals that can address those internal factors, especially specialists in hormone balance and thyroid disease, because these not only play a huge role in melasma, they also play major roles in acne and rosacea. Whether you find an endocrinologist, alternative medicine physician, or nurse practitioner, it has to be somebody that you feel very comfortable with and also shares your business philosophy. And don't stop at those medical professionals. You can help your clients find solutions for body, mind, and soul. Doesn't that sound amazing? As skincare professionals, our main area of expertise includes utilizing a balanced and complete skincare system. Successful skincare professionals are true personal trainers for the skin and understand that the only way to achieve bright, beautiful, healthy skin is through a total skin health program that can be tailor-made to individual skin types, tones, and conditions. Lira Clinical Skincare System meets this need and is committed to total skin health by incorporating the very same proven principles that you'll find in a total fitness program for the body. Just like our bodies, our skin needs to eat, drink, and breathe to thrive. It also needs protection. Through an easy 3-step daily home care program, Lira Clinical topically loads the skin with vital nutrients, vitamins, minerals, essential fatty acids, and antioxidants. You'll also find some incredible brightening agents in over 98% of Lira Clinical products to help minimize hyperpigmentation and maintain an even skin tone and beautiful glow. For healthy barrier protection, in addition to daily physical sun protection, Lira Clinical provides potent anti-inflammatories, naturally compliant hydration, and topical probiotics for a healthy microbiome. We know that physical exercise helps to improve our body's overall health and fitness. Stimulating, active products and in-clinic procedures can have the very same effect on the skin. For what I consider home exercise, Lira Clinical offers 2 types of stimulating and rejuvenating products for home care. For all levels of skin health, non-wounding actives such as designer peptides and BVOSC, that lipid-soluble form of vitamin C, help to stimulate collagen synthesis, increase cell turnover, and boost circulation and lymphatic drainage. For more challenging conditions that require advanced correction, like melasma, Lira Clinical's selection of active home treatment products offer a much higher level of intensity through retinol and hydroxy acids. Working out with a professional trainer can certainly challenge the body by raising that level of intensity even further. Lira Clinical's professional Smart Peel procedures are true professional workouts for the skin, taking stimulation, rejuvenation, and skin correction to the next level. After those intense, professional, in-clinic Smart Peels, skin needs to rest and recover. Lira Clinical provides essential nourishment needed for optimal post-procedure care, enhancing the natural healing process while also protecting skin from the environment. Now let's just take a look at how Lira Clinical skincare system is used to lift and improve that hyperpigmentation from melasma. Now there's no doubt, it takes quite the juggling act because melasma is a complex skin condition. That requires a complex plan of action to improve that hyperpigmentation. We need to load that skin with serious nutrition and protection to encourage healthy functions while simultaneously doing a lot of things to disrupt other functions. The list of ingredients alone can be quite overwhelming. The good news is that you can consider Lira Clinical your multitasking masters of melasma. They truly simplify the treatment and corrective process, beginning with their advanced product formulas. To disrupt that process of hyperpigmentation, you'll find all of those essential ingredients that we discussed in part 1 of this series, and even more, in Lira Clinical's multitasking products. Lira Clinical's day creams are all-in-one products providing barrier and physical sun protection while also limiting inflammation through antioxidants and brightening agents. We know that inflammation and hyperpigmentation go hand in hand. That's why Lira Clinical pairs potent tyrosinase inhibitors with powerful anti-inflammatory agents in corrective treatment serums and creams to suppress melanocyte activity. And to take correction of hyperpigmentation one step further, Lira Clinical utilizes ingredients like niacinamide and green tea to help prevent that melanosome transfer. These multitasking ingredients also brighten the skin, minimize inflammation, and provide powerful antioxidant benefits. To help lift existing hyperpigmentation within the skin, Lira Clinical incorporates active resurfacing agents into corrective serums and creams for home treatments, while higher concentrations of those actives are found in professional Smart Peel resurfacing solutions. Now let's put these powerful ingredients and products into action for a highly effective targeted treatment plan for melasma. And there's really no need to overthink this. This treatment plan I'm going to share with you has never let me down. And besides melasma, you can apply it to all types of hyperpigmentation. And there's a great bonus. You'll also see improvements in the signs of aging and hormonal acne. Now, this is what the very first appointment with your melasma client will look like. After a thorough consultation, skin analysis, and assessment, you'll provide a professional Lira Clinical signature treatment that day. You'll follow that by providing their home care prescription and complete that appointment by scheduling their first corrective Smart Peel of their treatment series. So yes, it really is as easy as 1, 2, 3. Lira Clinical offers 4 signature treatments to choose from. The Brightening Plus is my personal favorite for melasma. It specifically targets hyperpigmentation through a combination of lactic acid and tyrosinase inhibitors. Now, if you're not familiar with Lira Clinical's protocols, signature treatments are considered hybrid treatments. You'll see more corrective results than a facial, but they're not as intense as a straight peel procedure, making them perfect first time, anytime treatments because no prepping is required and there's no social downtime. Once you've completed that signature treatment, you'll provide a powerful home care prescription. And remember that this is the most important step in our targeted treatment plan because daily care and treatment will provide at least 80% of overall results. This home care prescription is a wonderful balance of daily nutrition, protection, and hyperpigmentation correction. And there's another bonus. These products will also be used for mandatory pre-peel prep and conditioning, post-procedure care for optimal healing and recovery, and continued correction and maintenance after those in-clinic Smart Peel procedures. I want to show you the home care regimen I started my melasma clients on. Now I'll go through these specific products in just a bit. For right now, I just want you to see how easy it really is to get someone started on Lira Clinical's advanced home care and correction. It only takes 4 steps in the morning and 3 steps in the evening for a total of 5 products to get started. Then once that skin gets acclimated to this routine, I can fine-tune it even further by adding in an accelerator or enhancing hydration if needed. Occasionally, I did have to make an adjustment, for example, a client during pregnancy, but for most, this was definitely the winning recipe to success. Now, let's see why those products in this regimen are so effective on hyperpigmentation and how I recommend putting your home care prescription together. This method can be used when treating any type of hyperpigmentation because it's based on what that skin needs. Now, I always start my home care prescription by choosing the corrective products needed, and then I'll build the rest of the regimen around those. Now, how many corrective products that skin needs for true results will depend on the severity of that condition. So, when it comes to hyperpigmentation, just give it a grade. As you're analyzing the skin, would you consider it mild, moderate, or severe? If it's mild, only one corrective product will be needed. And for hyperpigmentation, always start with Lira Clinical's Pro Light Serum applied twice daily after cleansing. This is Lira Clinical's brightening powerhouse packed with Tyrosinase Inhibitors and anti-inflammatories, those two main types of ingredients needed to disrupt that process of hyperpigmentation. If it's moderate, 2 corrective products are needed. That's when I add in a retinol product for that additional correction, especially to help lift existing hyperpigmentation. For persistent melasma, I highly recommend Lira Clinical's Pro Retinol Cream because to me it's the perfect, most powerful, multitasking, corrective home treatment cream to improve all skin conditions, but especially hyperpigmentation. Pro Retinol Cream includes 3% retinol and 7% lactic acid working together to exfoliate, lift, lighten, and brighten. In addition, you'll find vitamin C and hexylresorcinol all in a soothing, non-comedogenic shea butter base. Pro Retinol Cream is applied in the evening only, right after Pro Light Serum. For severe hyperpigmentation, it will take 3 corrective products to achieve optimal results. And knowing how stubborn, persistent melasma can be, I always put it in the severe category. This is when I add a corrective vitamin C product. And for melasma, we must be very selective about the form of vitamin C that we choose. It must provide effective correction without triggering inflammation, like the daily use of high concentrations of L-ascorbic acid can. Lira Clinical's Mystique Intense C15 Booster checks all of those boxes. It contains 15% BVOSC, that wonderful pH-balanced, lipid-soluble form of vitamin C with enhanced collagen synthesis, brightening, and anti-inflammatory benefits. Intense C15 Booster is applied in the morning, right after Pro Light Serum. Now, Intense C15 Booster has always been a part of my original melasma treatment plan, but last year, Lira Clinical released Mystique Infused C, a second option and an upgrade from Intense C15 Booster. Infused C also contains 15% BVOSC, but it's even more powerful when treating melasma because it also contains a powerful entourage of terpenes, minerals, glutathione, and 500 milligrams of clinical cannabidiol isolate. So I do recommend making the upgrade. So there you have it, my trifecta of corrective products for treating melasma at home. Now, if you're used to recommending a combination of prescription tretinoin and hydroquinone, I've honestly found that this is just as effective and much more balanced and skin-friendly without the controversy or extreme side effects. Plus, you don't have to take a break from any of these corrective products like you do with hydroquinone. And then if you do have a client that for any reason can't use retinol, like during pregnancy, for example, I increase the use of Mystique Intense C15 Booster to twice daily, and then add in Pro Firming Serum twice daily, right after Pro Light and under that C15 booster. So no, you won't get to that correction as quickly as you can using Pro Retinol Cream because it's not as active, but it's safe for use during pregnancy. Pro Firming Serum contains that 1-2 punch against hyperpigmentation, both tyrosinase inhibitors, including hexylresorcinol and C-phenyl plant stem cells, plus anti-inflammatories, including ginger and colloidal silver. Now that we've chosen our corrective products, we can complete that starting daily regimen. When using active products like Pro-Retinol Cream, I always recommend choosing a gentle cleanser, whether my client prefers the creamy Mystique Illuminating Cleanser or Bioenzyme Cleanser, which is a universal gel cleanser. Then select a day cream based on their skin type and preference. The Solar Shield line can be chosen by skin type, although my personal favorite for anyone with hyperpigmentation is Solar Shield Classic Tint. Besides 21% zinc oxide to keep skin cool and protected, Solar Shield Classic Tint hydrates, minimizes inflammation, and has extra protection from the rays of our digital screens with added niacinamide. It also provides a very nice sheer tint. For clients that want simple and easy, BB creams are all-in-one anti-aging day creams with built-in sun protection. They also provide a beautiful, flawless finish with medium mineral coverage. Once skin gets acclimated to that starting regimen, for continued correction and to wake that skin up again, I like to bring in an accelerator. Now, if my client is already using retinol, you can choose an accelerator for additional correction that does not have retinol. That pro-firming serum mentioned earlier would be a great choice. Another option is Mystique Illuminating Polisher as a brightening mask, just a few times a week. The most powerful accelerator for hyperpigmentation will be the Pro Anti-Aging Pads, and in my opinion, these are a melasma must-have. Pro Anti-Aging Pads are true home peel pads, delivering 7 anti-aging and brightening acids in a healing peptide delivery system to minimize inflammation. There's also an extensive list of tyrosinase inhibitors, all balanced by probiotics and soothing botanicals. These really do target hyperpigmentation, and I like adding the Pro Anti-Aging Pads in just one night a week to begin with. They can be used up to 3 nights a week, but just remember to skip Pro-Retinol Cream the day before Pro Anti-Aging Pads are used. At any point during advanced corrective home treatment, the use of those active products may cause some side effects, so it may be necessary to bring in some extra barrier protection to help increase hydration while reducing irritation. Lira Clinical offers several options, so I'll share my top 2 favorites that are universal for all skin types when treating hyperpigmentation. My top pick is what we call liquid gold, Lira Clinical's Mystique Illuminating Beauty Oil. This is a lightweight, luxurious, hydrating oil that helps to repair, restore, and brighten the skin all at once. Illuminating Beauty Oil contains lipid-soluble vitamin C plus 12 highly therapeutic oils including mastica, hemp seed, argan, sea buckthorn, and pomegranate. As far as application, in the morning, I like adding a drop or 2 to any day cream, and then in the evening, I recommend applying 4 drops of the beauty oil directly to the skin immediately before Pro-Retinol Cream. Sometimes a client may need to take a little break from retinol, so in this case, Illuminating Beauty Oil can be applied instead of the Pro-Retinol Cream. My next pick pleasantly surprised me when I started experimenting with it because, for some reason, I was just never a huge fan of using masks at home. But this one changed my mind. Biohydrating Mineral Mask replenishes hydration, restores a healthy barrier function, and brightens while reducing redness and irritation. And it smells absolutely delicious. In this mask, you'll find even more vitamin C, lightening agents, probiotics, soothing botanicals, and those wonderful healing minerals of colloidal silver and gold. This can be applied as a treatment mask as often as needed, but my favorite way to use Biohydrated Mineral Mask is as an overnight sleep mask. I just mix a little bit of the mask with 4 to 5 drops of Mystique Illuminating Beauty Oil, apply that right before I go to bed, and when I wake up in the morning, my skin looks and feels absolutely beautiful. Even if you don't have hyperpigmentation, I recommend that you give this a try. You will not be disappointed. After reviewing the home care prescription, we can now wrap up that first appointment with our client and schedule their first corrective smart peel procedure. Remember that clients with melasma are at a high risk of post-inflammatory hyperpigmentation. For this reason, we schedule that first corrective smart peel no less than 6 weeks out. This allows for plenty of time to properly prep and condition the skin to help reduce that risk of PIH. And for that 6-week prep time, no additional products are needed, so they can simply follow their daily corrective home care regimen. The only special instructions will be to tell them to discontinue use of pro-retinol cream and any additional active accelerators before that smart peel procedure. And my rule of thumb was to have them discontinue use 3 days before level 1 or level 2 smart peel and 5 to 7 days before any advanced smart peel. Now it's 6 weeks later and our client has arrived for their first corrective smart peel procedure in Lira Clinical's 3D treatment series. And if you're not familiar with the smart peel series, you'll love it because to me it's absolutely brilliant. We peel in a series of 3 different treatments, and by following a different protocol for each smart peel within the series, we're able to really wake up the skin each time for enhanced correction, just like cross-training the body. With this approach to corrective peels, it's very possible to achieve optimal results in half the time it takes a traditional series of 6 peels. Now, if you're wondering which protocols are best, this is what a typical Lira Clinical 3D series may look like for improving the hyperpigmentation of melasma. After every smart peel, regardless of treatment level, proper post-procedure care is critical to ensure optimal healing. All of the products in our prescribed home care regimen may be used for post-procedure care with the exception of those active products with retinol or hydroxy acids. Those should be discontinued until all shedding is complete. And for our advanced smart peels, that's typically about a week. Also for advanced smart peels, because of the depth of those procedures, when skin is shedding, it's necessary to bring in extra protection and provide a moist healing environment. We could do this with Lira Clinical's Health Recovery Balm. This is a semi-occlusive healing balm with colloidal silver and gold, aloe vera, and vitamin E. And with Health Recovery Balm, for the daytime, I love mixing it with my Solar Shield or BB cream and just reapply it throughout the day as soon as my skin starts feeling dry and tight. In the evening, I just apply it directly to my skin. Once shedding is complete, we can start using those active products again. And at this point, to really help maintain those in-clinic smart peel treatment results, if I haven't already done so, I can still add in those pro anti-aging pads for some great maintenance. And speaking of maintenance, as I mentioned in part 1 of this series, managing the symptoms of persistent melasma is a daily, lifetime commitment. I really do call it the melasma dance because we're constantly going back and forth from maintenance to correction and back to maintenance again. It's just the nature of this condition. And not everyone's dance will be exactly the same. For example, if you live in Florida where it's always hot, your melasma dance is probably a fast cha-cha, needing correction much more often. I live in Wisconsin, so I'm doing a slow rumba because I'm usually hiding inside the house during those brutal winter months. I've been doing this melasma dance for over 20 years, and I can honestly say that I'm happy I found Lira Clinical. They've made managing my melasma so easy. I have to use products every day anyway, so why not dance with the best? And if you do, you can expect some incredible results. I'm Linda Amato. Thank you for joining me, and I hope you learned something new today. For details on featured products, protocols and local training classes, please contact your Lira Clinical Regional Manager.